in existence for about 6 years and supported through the Centre for HIV and Sexual Health. And we've got our lovely volunteers who go out and do a lot of outreach work within the community, working with African communities. So I won't take much of your time, so without further ado, I'd like to welcome our first speaker, who is Steve Slack, who is the Director for the Centre for HIV and Sexual Health.
I'm delighted that the event's gone ahead, because last year, as you remember, we had really heavy snow and we weren't able to continue the event, so I'm glad the weather's not kept us all the way this time. So, as I was driving here today, I was recalling I used to live around here, and when I was new to Sheffield, I felt very much like an outsider, because I came from the Midlands, and it takes some time, when you're an outsider, it takes some time to feel that you belong. And I was thinking actually, I think one of the things, when I talk to people who are living with HIV, one of the things that they feel sometimes is that they're an outsider. And I think my theme today actually is we should encourage people not to feel as outsiders, but they should feel that they're part of all of us, and that we're all outsiders in different ways. And I think it's really important that we come together as communities and we don't allow people to be outsiders. I want to thank the peer educators for organising this event. But also I want to thank you for all the important work that they do in Sheffield. It's a really vital piece of work. And I was talking to Rebecca, who will be speaking to you later, and we were saying it's so important that peer educators go out and give those messages. And they're a committed group of people, and they're determined to ensure that the African community receives up-to-date information regarding sexual health. And we all know how difficult that is, and how personal and difficult those areas of work can be, and how difficult areas of people's lives they are. And the peer educators were supported by members of the team here from the Centre for HIV and Sexual Health, and I'm really grateful to them, and they've hidden somewhere, I don't know. So I'm grateful for the support that they give to the peer educators. So why are we here today? Well, today is to commemorate World AIDS Day, so it's about remembrance, it's about reflection, and it's about contemplation. And for me, it's about remembering those who we've lost from the virus, but also thinking about those people both here in the UK and in Africa and in other parts of the world who are still living with the virus and are accessing good treatment. So it's a time to think and to reflect. I think it's a bit more than that as well. I think it's about a time to action. It's a time for us to say, actually, enough is enough. And actually, we've got to begin to challenge the stigma around HIV. We, and I mean all of us, have a duty to go and challenge that stigma. So it's about breaking the silence. And that's about breaking the silence in all of our communities. And that's why we call today Breaking the Silence. But I fear that silence around HIV is growing. And I was talking to a gentleman here earlier, and he was agreeing that actually 30 years ago, certainly in Sheffield, yes, I was around 30 years ago, so don't take it off. We have lots of campaigns around HIV, so people were much more aware around HIV. We seem to have lost that nowadays. And we know that in continents such as Africa, which continues to be one of the areas in the world most badly affected by the HIV epidemic, thousands of people continue to die. And I think it was in South Africa I was listening to the radio the other day, and they were saying that the death toll is still nearly 1,000 people a day, which is just incredible. Particularly when we have good treatments and good opportunities to help people with the virus. On a hopeful note though, the United Nations reported that there are signs that the global epidemic is declining, but this report also said that stigma and discrimination cause problems for people who are living with the virus. So over the last 30 years we've seen really good developments in terms of treatment, and certainly in this country in terms of protection, legal protection for people living with HIV. I think that's really important. 30 years ago, the messages about HIV were much simpler. Sadly, if you've got HIV, you would die. The picture today is much more complex. With early detection, good treatment, and adhering to that treatment, the outlook for most people is good. However, we do have to recognise that it does have serious medical and psychological psychological impacts on people still, particularly if people don't test early. And also stigma affects people's mental health. It has an impact on them, so they're not able to talk to their family, they're not able to talk to their friends. And I just think, I increasingly, again I was talking to Rebecca, I increasingly hear doctors say it's like diabetes. I'm sorry, it is not like diabetes. If people have diabetes, they tell their children they have diabetes, they tell their parents they have diabetes. They go out and they tell everybody they have diabetes. My father had diabetes, we all knew. If you're a parent, it's not always easy to tell your children that you've got HIV. There is a difference. There may be a similarity in terms of treatment and in terms of the fact that medically it's a long-term chronic illness, but it's not the same. I think it's really dangerous for us to tell people it's like diabetes, but we know that the impact on people's lives is very, very different. Half the people who were questioned recently in a survey said that they feel guilty or they feel ashamed of being HIV positive. Nearly a quarter of those people said that they've been verbally assaulted, harassed or threatened in the last year. I'm not aware of anybody who's harassed or feels guilty for having diabetes. I think we have to just be aware that it's a much more complex issue. And I'm sure, and I know all of us here today, want to live in a world or live in communities where people, where people are made to feel good about themselves, not where they're made to feel bad because they have a virus, or indeed abused because they have a virus. At the end of the day, HIV is a virus. I also worry, and I say this as a parent, that we're not adequately educating our young and preparing them for the realities of relationships and the realities of sexual relationships when they're old enough to engage in those relationships. And all the surveys that have been reported recently suggest that most young people don't talk about HIV, they don't know about HIV anymore, we don't talk to them about it. So I think we've got deteriorating levels of HIV awareness, we still have stigma, and it creates a perfect storm. So it prevents people from HIV testing, and then it makes the lives of those living with HIV very, very difficult. So what we need to do, and we need to begin to do it now, is challenge HIV stigma, both in our schools and in all of our communities. And we shouldn't just target certain communities. This is across the board in all of our communities. So we need prevention messages, we need anti-stigma strategies, and the two are linked. And if we don't do anything about those, we will see levels of HIV continue to rise in this country. So next year, I want to see more people aware of HIV. Other than this room, I've not seen anybody this year out in town wearing a red ribbon. I see people wearing it, people out there aren't taking this seriously and they're not aware of it. So I'd like to finish today by saying, I'd love you to think about what you're going to do when you leave here to raise HIV awareness, to challenge our own prejudices and challenge the prejudices out there. Because we all have them. I mean, let's be honest, we all have prejudices of some sort or other. And I think we've got to begin to challenge those. I want to know what we're all going to do to challenge stigma. What are we going to do? What can we do as a community in lots of different communities? And what are we going to do to educate our young people? I was delighted, I hope you don't mind me saying, Rebecca, you were talking about talking to your children. And I was really impressed by what Rebecca was saying, that she talks very openly to her children. And I think that is really important. Many of you here today are leaders. You're proud and respected members of your communities. And that is why it's so important that you all come together. And I know, having spoken to you, that all of you want to see the world become a better place. A more caring, just and acceptable place for your children, for your families and for your communities. We actually have it within our power to begin to make small changes which will make a significant change to our communities and the lives of everyone. We have it within our power to educate the young and to educate those who are ignorant of HIV. We have it within our power to challenge the stigma and the negative attitudes around HIV and all those associated injustices. And I hope you'll forgive me for using this quote, but it's from the great, well I consider great religious leader, Bishop Desmond Tutu. And what he said was, if you are neutral in situations of injustice, you have chosen the side of the oppressor. And that's what I genuinely believe. If we are neutral, we take the side of the oppressor. Thank you for listening to me today. I hope you enjoy this wonderful event, and I hope you go out there the amazing messages that the peer education has already begun to spread, and you continue to do that. And I cannot thank you enough for that. Thank you for allowing me to rant for a few minutes. Thank you very much.